Hi, good evening, and the time is 9 o'clock, 22 5:20. And today we'll deal with orthopedics. So, I'm having handbook of orthopedics, and which is highlights on classification, basic treatment guidelines by Hitesh Gopal and you, published by JP. And so you would like orthopedics as more. So like we had a 1 month of postings in the orthopedics. And so also like 2 months of posting in surgery. So you are questioning like whether even in surgery 2 days or 5 days I was absent. So they were questioning like is it like enough? Yeah, it is not enough. So I thought you were asking for the leave and reasons, but it's not enough really. Because I was on road, I was not able to recognize. So having a good sleep also. Um, so okay, let's hope for some more donations. And yeah, certainly we are not going to be at home always. Like this itself is making a big change in the society. Just we are on holidays, and um, so we're having the first chapter. So, orthopedics has different parts, and different books has different definitions. So here we have simple definitions. We are having pediatric orthopedics, pediatric trauma, adult trauma, general orthopedics, hand and wrist, spine, foot, and sports medicine. Okay, let me take the book, one book for reference which we are using for orthopedics, and compare both. Um, I have got all possible books, um, and especially even in first year, I got all the possible books to help me. Because I'm settled with as a doctor, so lifetime I have to refer only these and read these. So I brought the books previously itself. So I'm having Essential Orthopedics by J. Maheshwari, 4th edition, and also these books available during the study time. We get priorly, and which is less of cost, and also gives the entire depiction of the subject. So, the contents are orthopedic trauma, introduction, anatomy of bone and fracture healing, treatment of fractures, general principles, splints and tractions, recent advances in treatment of fractures, approach to patient with a limb injury, complication of fractures, injury to joints, dislocation and subluxation, fractures in children, peripheral nerve injuries, deformities and their management, treatment of orthopedic disorders and general review, injuries around the shoulder, fracture humerus, injuries around the elbow, injuries of the forearm and the wrist, hand injuries, pelvic fractures, injuries around the hip, fracture shaft of the femur, injuries around the knee, injuries to the leg, ankle and foot, infection of bones and joints, tuberculosis of bones and joints, infection of the hand, congenital talipes equinovarus, that is CTEV, congenital dislocation of hip and other malformations, poliomyelitis and other neuromuscular disorders, then bone tumors. Then we have one more page, that is prolapsed intervertebral disc, approach to a patient with back pain, spinal injuries, traumatic paraplegia, scoliosis and other spinal deformities, arthritis and related diseases, degenerative disorders, affection of the soft tissues, metabolic bone diseases, miscellaneous affections of bone, miscellaneous regional diseases, amputations, prosthetics, orthotics, arthroscopic surgery, joint replacement surgery. So we are having 42 subjects, and like different names. And orthopedics is quite easy. Only seeing from exterior it looks as though has a different one, as a big subject, but only the operations are closed and closely done to prevent infections. So this book is a very beautiful book, and it has diagrammatic pictures and flow charts and all of the things. So if you have a free time, I recommend to read this book as a story and have some orthopedic knowledge. And okay, let's go into the handbook of orthopedics. So, see what I have. I'm having a good camel by here now. So, do you like camels? I like camels, and our Vinayaga Missions College has a camel, and I like it very much in the shed. So, whenever I come out of Nepal, so usually Nepal is my destination. A beautiful place to visit, and because there is a Dhyana temple and in Naples Buddha temple, so there I go. And there is a 160 feet of Anjaneya temple there, and world famous. And so next we are going to have this Malaysia Muruga temple here. So in Etapur, in nearby Valapadi and Atur. So I wish the work goes on well, is under completion, but I don't know how it's going to resist the rain and thunder. But anyways, see, my house is full of clouds, and always with the ultraviolet rays and lightning. So even I glow in the dark. So um, let's go into handbook of orthopedics. So, and also, like, I would go to the Elagiri estates, that is Uruguay, and go and speak on the camel meat. And the so we have the digestive system of the camel and cow, especially, so which is very important in the zoological terms. And so we'll deal with the digestive system of the camel, and go to first we'll deal with camel. If we have time, we could go and see the digestive system of the beef, actually, but I think we'll not have time. So we'll deal with digestive system of camel in the Uruguay, and also in Valasiur, the Cyprus Islands. There is a camel cultivation there, and also in places where we get it, so we can find it uh, as possible. So, and I was uh, talking about the honeymoon destinations. Usually, I was talking to my sister. I was talking about she's studying 10th standard, isn't? So I was talking about the like the places, important countries and beautiful countries which I have visited through maps and through satellites. So Especially Cyprus Island is very beautiful. So I think I could, after marriage, I could go there for my honeymoon. So I have planned for Cyprus, and Cyprus is one thing which is very beautiful. And I would not be going to England and all, or France, or the European countries. I'm not at all interested in it. Or I'll go to New Zealand, to see the Great Barrier Reef in Australia, or Philippines would be very good. Or I have planned for some three countries: Alaska, so which I met previously in Magudanjavadi. So Alaska was very very beautiful, just like Kadal Rojave Inge Ni Enke. So and so My sister is the governor of Alaska, I think. So, but now by present, she is the governor of Canada, and um, Alaska is a very beautiful place, and also Uganda. But Uganda I'll not be going because it's in Africa and very much scared of mummies. And Nile and Mississippi are very beautiful, but not for a um, like um, going as a pair. So um, and also Iceland and Greenland is also good, but I prefer Alaska, or Cyprus mostly. So I'll be going to both of these countries together, and so even this Alaska's satellite picture is seen in this Krishnagiri Dam. So on the dam construction, you could see the Alaskan picture. Actually, it is like Kabul, I think, seen as from the uh, Vaniar Dam, usually. Not the Krishnagiri Dam, from the Vaniar Dam. So, we'll see on congenital anomalies of lower extremity. Polydactyly, when Watson classification, preaxial polydactyly, short block first metatarsal, wide metatarsal head, postaxial polydactyly, Y metatarsal, T metatarsal, wide metatarsal head, complete duplication. So, surgical treatment is amputation of the accessory digit. So, and the next is cleft foot. So partial adactyly, cleft foot, lobster foot is an anomaly in which a single cleft extends proximally into the foot. So Abraham's classification, type 1 has a central ray cleft or deficiencies, usually second or third rays or both, extending up to mid metatarsal level without splaying of medial, medial or lateral rays. Type 2 has a deep cleft up to the tarsal bones with forefoot splaying. Type 3 is a complete absence of first through third or fourth rays, no surgery. So treatment is type 1 soft tissue syndactylism with partial hallux valgus correction if needed. Type 2 is soft tissue syndactylism with first ray osteotomy if needed before the age of 5 years. Type 3 is no surgery. So then we have metatarsus adductus. So it's Black's classification, mild form. The forefoot can be clinically abducted to the midline of the foot and beyond. Then moderate form, it has enough flexibility to allow abduction of forefoot to the midline, but usually not beyond. Rigid metatarsus adductus, the forefoot cannot be abducted at all. So treatment is mild deformities. No. Treatment is mild deformities, no treatment, moderate and severe deformities, stretching and serial casting. So, indications for surgery: severe deformities uncorrected by conservative measures, pain, difficulty in fitting shoes, objectionable appearance. So, then we have surgery, that is 2 to 4 years, Heyman, Herden, and Strong procedure, tarsometatarsal capsulotomies, greater than 4 years, Berman and Gartling procedure, multiple metatarsal dome osteotomies, medial cuneiform lateral cuboid double osteotomy. So then we have NB, that is Q foot, also called as Z foot or serpentine foot. It's a complex deformity consisting of forefoot adduction, midfoot abduction, and hindfoot valgus. So then we have club foot. One theories of origin is Irani and Sherman's theory. So it's of Irani, a person from Iran, I think. So primary germplasm defects in the talus, developmental arrest theory, Dunne's fetal theory, mechanical block by extrinsic pressure in utero, Isaac's neurogenic theory, increased type 1 muscle fiber. So, and you must have heard about Isaac Newton. And myogenic theory, atrophy of leg muscles, vascular theory, hypertrophic anterior tibial artery. So then we have differentiating features of non-rigid and rigid club foot. So I think these are going to be a readable one as of, and so, instead, we'll just read the topics and go on. So, because I have to give a lecture, and so extrinsic non-rigid and intrinsic rigid. Um, so normal size, mild varus, smaller market varus. Normal size can be brought down with ease in the heel, and small elevated cannot be brought down with ease. So the minimal varus and market varus. So creases are more or less normal, deep medial, posterior, and plantar creases, reduced creases laterally. Telescopic is that negative and positive. So these new words are added on into the presenting manual. And Apollo and Ponseti theory of retracting fibrosis, myofibroblast contraction, mainly implications. So even this word creases and all, we were not able to tell it as casual. So it was somewhat, I felt it very difficult to remember. I was just forgetting and forgetting, and so. Then we have radiography, normal range, talocalcaneal angle, anteroposterior view 30 to 55 degrees, dorsiflexion lateral view 25 to 50 degrees, tibiocalcaneal angle, stress lateral view 10 to 40 degrees, talus first metatarsal angle, anteroposterior view 5 to 15 degrees. So then we have treatment, conservative treatment in the form of manipulation, followed by strapping or cast application starting immediately after birth. So see how a baby is struggling. So then we have surgery is indicated. There is no correction at the end of 6 to 9 months. Procedures are given. So Turco one stage surgical release, posteromedial release, modified MECK procedure through a transverse circumferential syncytial incision. Advantages are, so this is correction of, this is something like a continuation of anatomy. Correction of three-dimensional deformity of subtalar joint, correction of the internal rotation deformity of calcaneus, and release of contractions of posterolateral and posteromedial foot. For severe deformities, Carroll's two incision technique, a curvilinear medial incision and a posterolateral incision. So then we have treatment of resistant club foot. Hind foot varus, less than 2 to 3 years, modified MECK procedure. 3 to 10 years, isolated heel varus, Dewey's osteotomy. So this Dewey's osteotomy is very important, one mark. And short medial column, Dillwyn Evans procedure. Long lateral column, Litzblau procedure. 10 to 12 years, triple arthro disease. So I'm very much happy that we did not have orthopedics as a separate subject. We were included in surgery. If we had a separate subject, like all the 1 marks would be a doubt. And equinus, mild to moderate deformity, tendocalcaneus lengthening, and post-capsulotomy of ankle and subtalar joints. Severe deformity, Lambre procedure. So congenital vertical talus. So that we have S. J. Kumar classification, and so we have treatment also. Then we have congenital angular deformities of the leg. Then we have treatment. Um, so like then we have congenital pseudoarthrosis of the fibula, and we have classification and treatment. Then we have congenital pseudoarthrosis of tibia, and we have Boyd's classification. And so I was like underlining all of these. Then I had this review of surgery book also. I was underlining all of these, just not in an anger, just was not able to read. I was feeling very boring. And then we have McElwain's concept. Then we have treatment. So let's read about the concept. Heavy cuff of tissue surrounding the bone at pseudoarthrosis may decrease bone production and consequently healing. Resection of this tissue is important during surgery. So then we have congenital constriction bands, streetus dysplasia. So Hannigan and Cook classification treatment. Then we have osteoonychodysplasia, nail patella syndrome. So let's go into deep since we have a nail patella syndrome. So hypoplasia of nails with the thumb always affected, second to fifth fingers being affected, less severe or frequently. Elbow joints, cubitus valgus, limitation in extension and supination. Pelvis, iliac horns increased, coxa valgus of the hips with anteversion. So there are iliac horns and they are increased, and patellar hypoplastic, wedge shaped and displaced laterally and present as a recurrent dislocation of patella. Then we have treatment. So this patella is a bone which is in the knee, and we have this nail and patella syndrome. These are something like related to the moon and development. So as they keep on growing, but patella doesn't grow, but it has different pathological conditions. And then we have congenital hyperextension and dislocation of knee. Then we have the treatment. So then we have congenital dislocation of the patella and treatment. So let's see about the congenital dislocation of patella. So familial and bilateral treatment is release of contracted structure on the lateral side of the patella, lateral capsule, iliotibial band and lateral portion of quadriceps, medial plication of the lax capsule and medial transfer of the patellar tendon. So then we have discoid meniscus. So lateral more common than medial, and the etiology is Smiley suggested it was failure of the fetal discoid form of the meniscus to involute. So so it's a failure of the fetal discoid form of the meniscus to involute by birth, and the meniscus is derived from the mesenchyme. Is initially a disc and then forms a semilunar structure. And basically embryology we had only charts and some 10 pages to read. So there is a book on embryology, but I'll not be saying about it. I have to read it, and so you must be very happy with it. And treatment is preserve the meniscus, aim to refashion the meniscus. If type 3 will require refashioning and stabilization using a capsular suture. Then we have congenital deficiency of long bones, Franz and O'Reilly classification. So terminal or intercalary. So let's not deal with the long bones because they are less affected. Only by accident or trauma they are operated. And so next we have tibial hemimelia, Jones, Barnes, and Lloyd Roberts classification. So then we have the treatment of it, and we have fibular hemimelia. So we have, so what is this? It's like hypoplasia, complete absence of fibula and all of things. So then we have COI classification for distal tibial epiphysis in fibular hemimelia. Then we are having treatment. Then we are having increased femoral anteversion and the treatment. Then we are also having conservative operative derotational femoral osteotomy, indication, patch, gem for surgery. And the proximal focal femoral deficiency, 8 Kemp's classification is there, and treatment. And we have Paley classification of PFFD, Kalanchi classification of PFMD, and the limb length discrepancy, that is Shapiro's pattern. So let's see about it. Type 1 is the leg length discrepancy increases at a constant rate. Type 2 is similar in early to middle childhood, but the annual rate of increase diminishes thereafter. So then we have type 3, discrepancy first increases, and discrepancy is a small change, and first increases and stabilizes and remains unchanged. So discrepancy we have read in mathematics and some English word. And type 4 is similar to type 3 in early and middle childhood, but then increases towards the end of growth. Then we have type 5, consists of an initial increase, stabilization, and then decrease in discrepancy. So then we have leg length discrepancy treatment. So and Minila's method. So we are having many laws method, and so like ortho1 is done. So using single exposure with long cassette with a standardized distance between X-ray tube to cassette. Scanogram severe exposure are taken over a single cassette, eliminates magnification error, but child must be able to stand still and like. So then we have developmental dysplasia of hip. Graph classification and radiology treatment protocol, and then we have recommended osteotomies for congenital dislocation of hip. Then we have congenital coxavara, Hilgenrinus epiphyseal angle subtended by horizontal line connecting the triradiate cartilage and the physeal line, normal angle 30 degree. Then treatment is angle 40 to 60 degree. Observation greater than 60 degree subtrochanteric valgal osteotomy. So we have chapter 2, congenital anomalies of upper extremity. So like we are having congenital elevation of scapula, Sprengel deformity, like we're having associations. So let's read about the scapula. Associations are cervical ribs, malformation of ribs and nipple fail syndrome, maldeformity and impairment, no treatment, more severe, surgery may be indicated. Timing of surgery is 3 years. Surgery is Green's procedure, release of muscle from the scapula along with excision of supraspinatus portion of scapula and any omovertebral bone. Then we have Woodward procedure, transfer of the origin of trapezius muscle to a more inferior position on the spinous processes. Complication of surgery is brachial plexus palsy, can be prevented by osteotomy or morcellization or of clavicle. So, these words are quite difficult to remember, but not difficult to read, but remembering we would forget. So, what you can do is you can keep on reading, but don't leave reading. But after 1 year of time, you will be able to remember certain things, and if you read again everything will be memorized. So take it a turn, let time pass by. See, even if you did not read during those times, if you come across these words you will be likely familiar, because everything goes on with a single author. And so then we have delta fibrosis, Bhattacharya syndrome. So Indian name is given, and abduction contractures at the shoulder. Treatment is surgical release of bands. Then we have congenital muscular torticollis. So torticollis is something like a wry neck, isn't? So, fibromatosis within the sternocleidomastoid muscle, common on the right side, um, localized near the clavicular attachment of the muscle, usually disappears within a year. If it fails to disappear, muscle becomes permanently fibrotic and contracted and cause torticollis. And Greiser syndrome, atlantoaxial subluxation, secondary to upper respiratory infection in children, may be present as torticollis. So, proposed hypothesis for origin of CMT, then malposition of the fetus in utero, birth trauma, infection, and vascular injury, intrauterine or perinatal compartment syndrome. So then we have Cheng's clinical group. So this is sternomastoid tumor group, and those with a clinically palpable sternomastoid tumor, and the muscular group, those with clinical thickening and tightness of the sternocleidomastoid muscle. So then we have, so I remember Mount Vulture. So very much um, related to the sternocleidomastoid muscle. So, I was on Mount Vulture, so it's in the back side of the Huss College, and so I just went into. So usually I used to roam. There is about some 3 roads outside from college to Virapandi Lake. So there, what happened is that. So I know it was like a mountain, but it was there was filled with water, and nearby there was a big lake. Usually, I think that is my farm's lake. It looks like my farm well. So Victoria Lake, Lake Victoria, and it's in Germany. I saw a movie there. Then previous night, a Tamil movie comedy clip was there. So it was taken in Lake Victoria, and so just beautiful. And nearby Mount Vulture, there is another mountain also. And from there, I was sitting and talking about this movie, Punnagai Puve, and the song of Vanam Thuvum Poomalai, especially. So this Mount Vulture. and so the snake was showing its head on, and with the black snake was there, and I was seeing whether it is sunlight or some material there, or it's really a snake, but I was still observing very keenly. So this mountain was like flat, and so on the other side there was houses and the dogs there barking about. So in this lake there was this temple also, and so like filled with water, but this is fully something a golden color, something like skin of a camel, very golden, and maybe camel or a lion actually, and it had this is of Coquina rocks, and had this maybe like it's of igneous type, and had this like interior pits and round hollow water stagnating places. And I was walking along the path. I thought I could go very near, but it was very beautiful. But at the same time, we could not distinguish what is there and there. We could not see what is lying beneath. So we must be very careful with it. But local people usually do climb and be roaming. And next mountain which was there was looking like some. So we were hearing this. I was hearing the snake-like sound, which is like you could say it as a sulal when it happens with the wind cyclone. So the sulal sound happens in the when it's in rock. So it was a metamorphic rock, and so and the well that side was a sedimentary well, and so and quite beautiful, and so I had good times with them, and so then we have postural torticollis, that is those with the postural head tilt and clinical features of torticollis, but without tightness of tumor of sternocleidomastoid muscle. Surgery was commonly done in sternocleidomastoid tumor growth, and treatment is manipulations and stretching exercise in infancy. If not corrected by 1 year, surgery is undertaken. Surgery may be unipolar release, bipolar release. And also one thing with the farming and the mountains and discoveries is that we must be see this cultivations and growths, especially the meat cultivation. These remain very silent. That must not be there. See in here this side near Vietnam and this Sri Lanka and all of the places there, and the Cyprus and all, they are very much making aware of the cultivations and growths. So they have sounds like, and if there is goat cultivation, they have sound like goat, and they also have minor insects which make sound like similar to the organisms. So like you must make about it, but there, because there is less of there is more of wealth and less of money, and we can't make it. And also there is mines, lot of mines are there. So then we have cleidocranial dysostosis. So then we have congenital radioulnasonostosis. So like this cleidocranial dysostosis is very important. We have aplasia of clavicles, exaggerated development of the transverse diameter of the cranium, and delay in closure of the fontanelles. Clavicular portion of trapezius may be absent. Maldevelopment of the pectoralis major. Clavicular portion of deltoid may be deficient. Patient can usually approximate the tips in his shoulder to each other below the chin, and if pain is present from pressure of one or other of the ends, then removal of the part is indicated. So then we have congenital radioulnar synostosis. So the before is dysostosis, this synostosis, and if it is so it is radioulnar. Usually these are developing bones and usually are more prone to injury and fast recovery. And so then we have Wilkie classifications and treatment. Then we have congenital subluxation of the wrist, that is mad lung deformity, which we saw in anatomy previously. So this Brailsford theory. So, like there occurs defective development of inner third of growth cartilage at the lower end of the radius. This results in stunted growth of the epiphysis and diaphysis of the inner side. Growth of the outer two-third continues, and as a result, radial shaft is bowed backwards. The interosseous space is increased, and the lower end of the ulna is subluxated backwards. So, this is remembering me of this Ukupalayam lake. So, and the places, Chinna Uppapalayam, Peri Uppapalayam. So they have these kind of words, and often bilateral females and males greater than males appears frequently for first time in adolescence. Flexion may be increased, other movements are restricted and may be painful. So this like the radial shaft is bowed backward. They made a beautiful presentation. So like one road was there to the place, and full of these kolamava stones. So some calcium stones, and so fully the road was not metalled. We have to move on it. Considering the radial shaft is bowed, and there is a Krishna temple nearby, and a school and all is there. And so like and so backwards, and intraosseous space is increased. So this along the Tirumani Mutar overflow path, and we are having the Alaska, and also like, and the lower end of the ulna is subluxated backwards, and we are having backwaters there. So um, and again if you and it so this mad lung deformity is like into the chart usually, and the map, and so like I just left by 4 o'clock in the evening, and 7 o'clock I was in the center of the place in Uppapalayam, and so like but I was displaced outside. I was displaced into Kalipatti road, but again I wanted to be inside, so again I came inside. So then what happened, I got in the middle of the forest. So there this orange garnet mining region was there, and so but no way, I have to enter into the field only, and like one lady was there in the TVS 50, and so I was following her. So I was left in the middle of the farm, and it became it's going to be night, 6 o'clock in the evening, and then what happened, I just moved with her to the outside and to the main road, then I followed her. What happened was that in the map it is not very definite, and but nice Madeline deformity experience on the road, and so like clinical features, wrist appears enlarged, dorsiflexion of hand is impaired, in severe cases pronation and supination are limited. Then we have treatment. In recent or acute cases, dorsiflexion of a wrist maintained by full arm plaster for 4 weeks. Osteotomy of lower end of the radius may be done. So then direct subperiosteal resection of the lower end of ulna is an alternative. So I never expected that orthopedics would depict such a beautiful construction of road, because my grandfather was there, so he is basically from Rome, and so I must have already plotted out, but he is the um, governor of Rome, king, usually king of Rome, and he is the governor of Germany. So then we have osteochondrosis and miscellaneous diseases. So like osteochondrosis or epiphysitis is okay. Why I am not dealing with the long bones is that it forms the main part of the roads, and osteochondrosis of the metatarsal head, Friedberg infarction, and so as I have read it, I am very eager to go into. Okay, let's see. And epiphysitis of tibial tubercle, Osgood-Schlatters disease associated with patella alta, and we having leg Calvé-Perthes disease. So the Perthes disease is very important, and the catarrhal head at risk signs. So and we have Salter-Thompson classification and Herring lateral pillar classification, catarrhal classification, stages of Perthes disease is given, Walden-Storm stages is given. So this remembers me of this place. So there is what Orukal Malai and nearby Sankari. So that's also a fort and a beautiful one. And usually I think that is the Krishnagiri mountain, and then we have treatment, and where is derotational osteotomy.